So I guess that for now we do not have any question for Priscilla about the funding request. I will just give, a moment to Angela to speak briefly about the importance of women inclusion and representation and contribution in health intervention in general, but specifically for for HIV, tuberculosis, and malaria, and to understand why you need to be engaged with the process, and what your contribution can bring to make sure that we promote gender equality and we advocate for women's rights and priorities. Thank you, Angela.
Thanks, Alia, for this. And I just also want that I'm going to be sharing with you like the link of a survey that we created also with ICW. So you can also take the time if you want to express your ideas regarding your engagement with the CCMs. Feel free to take just like 3 minutes to fill this information, and it will ask questions regarding like if you were engaged, if you were not engaged. Remember that this information will remain also for us confidential. We are only going to use it like for an advocacy document that we are going to produce at the end. So we really reach like something, the Global Fund, with something technically written, as we believe that evidence-based information from the ground and from your own experiences is very critical for, for changing the environment in which we are working with the Global Fund. And regarding like the meaningful participation, I first want like to start by saying that women in public health, in general, and specifically for HIV, tuberculosis, and malaria, it's really key to have women in diversity that working on this sense, because that we are the first and sometimes the last lines of defense in public health, especially in emergencies or pandemics, as these 3 diseases. And we are essential for community protection, public health activities, and health security systems. It is known that women have already like participated in different projects, designs, monitoring, evaluation, and it has like really like increased the level of engagement with other like services, and promoting like a better understanding of the needs of women in the ground has helped many other projects to improve in health service delivery, especially for HIV, malaria, and tuberculosis. And also it's really key to understand that the women-led organizations, communities, and also part of the civil society, we are experts in advancing human rights and everyone's like security. We are developing successful community-led monitoring services, delivery models, community-led quality, assurance things, and communicating about health, because we are on the front line of the response to these 3 diseases. And why it's really important for us to be involved in this process is that we need to uphold gender equality and human rights inclusions in the different process regarding the Global Fund, and not only in the funding requests that happened already on window 2, but in the grant making phase, and also beyond the grant making phase, on the implementation of activities, monitoring, and also evaluating how these activities are implemented in the ground. It's really key to understand that ensuring inclusion of women and girls in the diversity is significant for like the pandemic response that we are currently living for the 3 diseases, and also for the preparation for the next pandemics that might arrive. You have probably perceived and lived this during the COVID-19 pandemic, that there were plenty of women, that most of them were like working on the first line of the response, but at the same time receive many charges regarding taking care of the family, taking care of the eldest. So there's still a gap, in the leadership part in which we really belong. And how can we really be part of it, not only having a seat, for example, on the CCM with no voice or with no action. And what we advocate in Women for Global Fund is that we have the means in terms of capacity building, but we also have the information, the evidence, so we can really like advocate with information that can change some requests, that can change the perceptions for for the inclusion of projects and policy making. And this is really important to highlight again, because having documents, written documents with evidence and with information from the ground can really make the difference. So once again, I encourage you to please feel also like the survey that I'm going to share on the chat. And if you want, just like to open the mic and comment on how do you feel this is important for you, or how hard it can be also sometimes, because challenges, we face challenges every single day in leadership and participation. And we want to understand also those challenges so we can plan and have advocacy strategies that can improve this level of engagement. Over to you, Alia.
Thank you. Thank you so much, Angela, for this interesting, intervention. And I think that all women working in the health fields are aware about, the importance of having them engaged in all the process, because they know what are the real, needs and asks of women in all their diversity. And I think it would be important to have some of your, thoughts and experience to know, how the process was in Ghana, what kind of strategies we can support to, make sure that your contribution are really taken into consideration. And if you have any comment about Priscilla's, intervention, or Angela's, please feel free to speak or to ask your question on the chat. I don't know, Priscilla, if you have anything to add.
Okay, so I don't really have anything else to add. I just want to open the floor for people to share their experiences as to whether they were able to participate. I think for a number of us here, for many of us here, especially the AGYW, I'm not totally sure, but the most active engagement we had was with the technical advisor from the Global Fund. That was the CRG assistance we had under HFFG that brought together the 4 groups of different young people together to take a look at the NSP and take a look at the modular framework of the Global Fund and select interventions we feel should be very important, specific to our diversity. So AGYW came up with their specific interventions. YPL-HIV did, YTB did, and then YKP also did. So I don't know if the team from AGYW has been engaged in other instances pertaining to the GC7 or pertaining to the funding request. But I know for the YPL-HIV, we have been engaged specifically under the CRG only. So I'm opening the floor for anyone else who has been engaged in any other way, or who has included their voice to speak up. If you haven't also, I'm also encouraging you to let us know how we can be more engaging in such spaces like this. So thank you very much.
Thank you, Priscilla. So the floor is open for your questions or remarks. So I'm actually just wondering if you all understand, the grant making process and how the funding request was submitted to the Global Fund on May 29, just to understand if, you have, the same information regarding how you can, work with the CCMs and to make sure that you are discussing and negotiating with them and making sure that AGW programs is really in the funding request and the final grant that will be approved by the Global Fund. So I think we'll give you 1 minute to think about if you have any questions or remark, or you would like to share any experience, and then we will give the floor to the first person who would like to speak up. I think in the meantime, and while giving you, I mean, the opportunity to think about if you have any questions about what just Priscilla presented or Angela, I would like just to share with you a timeline. Can you see my my screen? Priscilla, can you see my screen?
Yes, I can. Please, can you see Alia's screen? Please respond.
Yes, I can. Yes, we can see.
Great. So I want to make sure that we all understand how the Global Fund, I mean, grants is being developed and accepted, submitted by the country and the CCM. So when the country received, for example, Ghana received the allocation letter, which includes the amount of the funding the country received in December. So the country is preparing for the submission, whether it is by organizing country dialogues, by reviewing the national strategy, or by, I mean, creating committees that will discuss, I mean, the funding requests and the country priorities. So here we have this is the funding request process. So we all gather, all the stakeholders gather to discuss what they want to include in the funding request and how they want to use the funding to, I mean, ensure that there is a full response to HIV, TB, and malaria according to their national strategy. So they received the allocation in December. So they had from January to May, to 30 May, to submit the funding request after all these processes. And then just to understand, so the grant making process is starting from June 3rd until the end of October. Because if you can see here in the black, I mean, part, from the 3 to 17 July, there is the TRP meeting, which are the technical review panel. So this is an independent panel that receives funding requests from different countries, and they have to review, I mean, if the activities, the programs, and the budget respects, I mean, all the priorities that are in the national strategic plan of each country, and if they respect, I mean, gender assessments, human rights assessments, if they include community and key populations priorities, if they include, I mean, programs on human rights and gender equality. So they do a full review of the funding request. Then they start sending their comments to the country starting from July 17 for the window 2. For window 1, it was different dates. So they shared their comments, and also the Global Fund shares some forms, some grant making forms with the principal recipients according to the country. And the principal recipient has to fill in these forms and send it back to the Global Fund. And then we start with the negotiation process. So if you can see here, the negotiation process is from July until October. This is where you have to advocate for, I mean, women's engagement, for women's activities, for your priorities. So you have several months when there is feedbacks from the TRP, from the Global Fund, and the principal recipients. And it is the CCM that is responsible for all this exchange between the Global Fund and the principal recipients. So if you want to make sure that, for example, adolescent girls and young women's priorities are remains in the funding request, you have to work at the same time with the CCM, with the principal recipients, and to make sure that you are part of the negotiation, you are aware about the TRP review, I mean, outcomes, and about what they want to remove and to keep. So you have until October, then the PR submits again the final grant making document to the Global Fund, and there is a GAC decision, which is a committee that decides about the grants that the Global Fund receive. And finally, the board approval in November, where the principal recipient is informed that the grant has been accepted or not, and the grant starts in January 2024. So you can see here that you have you have time to prepare, to try to engage with the CCM and principal recipients, and to benefit really from this grant making process, because it is really important. A lot of CBOs and CSOs think that after the funding request, it is too late to advocate for their priorities, for their key asks and needs. But it is not too late, because we can still add some activities that were not given an important budget. We can advocate to keep a significant budget for some programs. And I think it is important to understand this. Thank you. So now that you have a full image and vision about the funding request, so I think we have some questions here.
Yes, I think that probably Catherine, that she posed the questions, she can comment on them. Catherine, are you there?
Please. Hello.
Yes, we can hear you.
So she has typed out some questions in the chat box. So I think she would like these questions to be addressed to see how we can help support in these areas as well. I don't know, Alia, do you want me to read what she wrote?
Yes, please. Yes.
Okay. All right. So she said, I think there should be capacity building and empowerment of AGYW. It should be amplified, most especially adolescents living with HIV and affected by TB, including persons highly at risk of contacting the virus. There's a huge gap in adherence and prevention. There are shortages of test kits in the various facilities as well. What measures are being put in place? 2, can we achieve the 95, 95, 95 when prevention procedures are poor? 3, is there effective monitoring on clearing goods at the port? Why do we receive test kits lost to their expiry dates? What happened if resources are put in place but there's no achievement? So these are the questions that Catherine is asking. I think some of them you may have answers to them, but some of them you may not have answers to them. But I leave that over to you, Ali and Angela.
Thank you, Priscilla. Angela, I don't know if you want to start or.
Yes. So with the first question regarding like capacity building and empowerment of adults, girls, and young women, of course, this is, it's including like the people and women that are like highly at the risk, or that are already like living with a different disease. And of course, there's like this gap, as you mentioned, in adherence and prevention. And that's why I was also saying before, like, how can we really work on not only, on the design of the projects, like saying like, yes, like we are supporting this activity in the new grant, in the new grant of the Global Fund, but we really need to advocate also for women-led organizations to be part of the implementing, to be implementers of the activities, so we can really understand and what's going on there, why there's like a gap in adherence and prevention. And some studies and some information from other countries also have shown that there's still a lot of stigma, discrimination, and violence in health services. So women do not feel like comfortable like reaching the services, or if they reach the services, they don't have like access to medicines, they have access to treatment or tests, because there's a shortage of these key elements. And we, as women-led organizations and women for civil society, we really need, to monitor this and leverage some of the key elements that we can find on those things, on those spaces. And one key tool that I want to share with you is community-led monitoring. Should be part also of the projects that are implemented with the Global Fund, because this community-led monitoring tool can really help us with some information from the ground to understand which are specifically the gaps and where are those gaps, and how can we really have information from what's going on the health services in the base. And also regarding like the like the shortage of test kits, I wouldn't say that I know what's going on specifically on Ghana. Probably some of you can just like tell me and tell us if you find that if you're going to services, then you don't find like appropriate like healthcare interventions for you. But we really need, as I said in my previous comment, like how can we really have information, not like only opinions from our side, but can we really use information based on evidence? And one specific tool, once again, is community-led monitoring, or being part of the implementers that are working on the country. So I will stop there now for for a minute, so you can also like share with us what's going on specifically on the ground, and if you have heard about community-led monitoring before, or if you have any of you know who are like the principal recipients and sub-recipients of the grants in your country. That's also really important for us to know who are they, so we can ask questions, so we can ask them to be accountable, so we can monitor what they are doing. I mean, that's also part of the advocacy. It's not only like, like to be on the meetings, but during all the implementation phase, we can always ask to the recipients and sub-recipients what's going on in the ground, and why there are these shortages, why the services are not provided. So my key recommendation is always to get like a mapping of the stakeholders that are on the CCM and on the implementers, and also get a list of their names and contacts, so we can always approach to them by email or asking them to have meetings together. Over to you, Alia.
Thank you, Angela. I know that we are not, able to answer all these questions that you asked, Catherine, but I think that about some of them, I would like to answer at least can we achieve the 95 without the prevention procedures? I don't think it is easily achievable, because if we don't have, the prevention mechanism and programs that are really strengthened in the country, it is, difficult to reduce the number of new infections, to also raise awareness about the prevention tools. So we have to have a really holistic approach to make sure that people know their HIV status, that they have access to treatment, and that their viral load is very low, so that they can ensure there is no new infection after that. So we have to ask stakeholders. They have to be responsible about achieving these objectives and these goals, because we have countries have important fundings and grants, and sometimes we do not see the results or a positive impact on the field. So this is why community-led monitoring is important, because we are able to monitor the implementation of the fundings, of the quality of services that are provided to communities and to women in all their diversity. And when you monitor the services, you can advocate for better services. You can ask the principal recipient to be accountable, to have information, to access to strategic information. So sometimes, like you said, we have resources, but there is no achievement. But in a lot of examples, in lots of countries, we saw that through this monitoring, this community-led interventions, we were able to change some situation, to improve the quality of services, and also to work on some important challenges for women, for communities, like discriminations and stigma in the health centers, in the community centers. So these are different aspects that we all have to work on, and we have to, I mean, like Angela said, try to start with the mapping of the stakeholders, and to try to, I mean, develop this network so that we are able to work on different aspects. So if do you have any other question? Also, I would love for you to share some experience instead, I mean, of asking questions. If you would like to talk with us about how you were, I mean, engaged in the funding request, if you do something regarding, I mean, AGYW programs or HIV programs. So maybe I can choose randomly from the participants lists, and then you can, I mean, talk about your experience in engaging maybe in the Global Fund process. So I will like to call Abigail.
Okay, so I've attended so many HIV programs. Recently, I went for one HIV program called the Gender-Based Violence, Intimidate-Based Violence here. And we spoke about the stigma and the violence going on in our community, people living with the HIV, the major stigma going on around us, yes. And I'm a model of hope. I work with HFFJ as well, and I'm part of a YAG member as well. So me being a model in the facility or in the community, I see people living with the HIV, and a lot of people are going through a lot of challenges that we try to motivate them, we try to educate them. But after the education that we do give them one-on-one, they go back to their various homes and find, let me say, challenge. Let me say they find it difficult to still taking their medication, end up defaulting. Yes, some also do understand it, and they do take their medicine. As time goes on, I do make sure I do check up on them, because that's my role being a model. Yes. And I've been part of different organizations that I've seen people living with this HIV, and I've learned a lot, because I always tell myself that there is life after HIV. If in Ghana here, people do not understand that HIV is a scary disease, what about other sicknesses, or what about other disease out there? A lot of people are really scared, still scared about it. That is why I placed the question that if there will be a strong education in the various communities, if there will be a very strong education in the various towns about this HIV program going on, that there is nothing, like you can still live, you can still work, you can still get married, you can still do whatever you want to do whilst you're having this kind of situation. Yes, you taking your medicine, you'll be suppressed, but it's very hard for Ghanaians to understand it. It's very hard for our community people to do understand. They see it as a scary thing. I don't know at first the education out there. I don't know how it was taught out there. But I thank God there are now organizations in Ghana that are really helping. They are really helping. They are really going to every communities, educating, having, let me say, support groups, having meetings upon meetings that they allow each and all of us to understand that there is life after HIV. So it's a great job you guys are really doing. And Global Fund, God bless you guys for really setting up this wonderful platform. It's really a great job. my issue now is I just pray dedication will be all over, everywhere, dedication, day in and day out in our schools, in our churches, in hospitals, they every time do it. But in schools, they can add it to their curriculum, and in churches. So if they are going to give the education, if it is one in a month, 1 week, they set up 1 week and just do education about this situation, it is going to really help. It is really going to help. It is really going to help. Thank you so much.
Thank you so much, Abigail. I mean, this is the kind of, experience sharing that I wanted to hear, because I want to just to reassure you that it is not the case only in Ghana. I mean, in different countries, stigma, discrimination, and fear from people living with HIV is always there. And I think it is because of lack of informations, because we are not investing in awareness, raising awareness of of people, because they don't have the information about how people are living with HIV, that they are taking medication, that they have they are not transmitting HIV anymore if they are taking the medication, the treatment. So I think that it is something that communities, women organizations have to work on. We have to strengthen capacities of healthcare workers. We have also to raise awareness and to sensitize different stakeholders. We have to work at the same time with the media, with the journalists, with the lawyers who are defending LGBTQ individuals. And we have to work on different aspects, but also on the educational aspect, that we have to start having awareness campaign at schools, with the teachers, with different areas. So I agree with you that it is something that really create a great an important challenge for each country. And also because of stigma and discrimination, some people living with HIV refuse to take treatments anymore. So it is also our role as civil society organizations to ensure that we have mediators that are well formed, and that they are capable of working on HIV related stigma issues, and also they are well equipped to support people living with HIV. So I would like to give the floor to Catherine. Yes, go ahead.
Hello.
Hello.
Hi, thank you very much for your support and then your engagement with us. So I've also participated in numerous health advocacies in the community based on HIV prevention and care. I am currently a community peer paralegal, supporting persons who have been abused, violated, discriminated, and all that. So cases that are of more criminal are being follow up, and we work with pro bono lawyers and then psychosocial counselors as well. So my experience based on seeing clients, my peers being defaulted, some are in denial, and some even get to stage 4, where they they severely refused taking their medications and a whole lot of issues. And most of the times I have to come up supporting them, because I love to see them healthy, just as I'm doing. And some of them go in for herbal medications when they are newly diagnosed, with the belief that the herbal medication will cure them, and there are pastors in the media, all over the media, saying they cure HIV. It's very serious. So like you said earlier, there should be education in the media and all that. And we also be glad if these pastors can also be sharp with our education on social media and all that. I think it will help support adherence and accepting one's status, because these herbal medications, when they take it like too long, it leads to kidney failure, liver issues, and a whole lot, where they will come seeking for support. Thank you, and over.
Thank you, Catherine. I think that personally, I think that we have to address, I mean, especially gender-based violence, because I mean, it is crucial, because it will help us to have an effective HIV prevention and care. And by addressing the roots of this gender-based violence, we can challenge harmful gender norms, we can promote gender equality. So this goes through, I mean, some comprehensive sexual education, about awareness campaigns, like we said previously, and also to work, I mean, on policies that will also protect the people living with HIV and women living with HIV, whether they want to, for example, disclose their status to their partners or any other situation. So Jamila, please go ahead.
Hello, everyone.
Hello.
Yes, I just wanted to ask if there is any penalty for prophets who comes out claiming they have a cure for HIV, because this their false information ends up making most of our people end up dying or defaulting their medication, because they think when they take the medication being given to them by the prophets, it will cure them, which is not so. Because of that, most people living with HIV end up losing their lives because of their false information. So I don't know how we can help with that. Thank you.
Yeah, Alia, let me answer that. So, Jamila, this question must be directed to the Ghana AIDS Commission, not to the Women for Global Fund. I think we should actually be informing the Women for Global Fund the active measures that are going on in the country, so they are also informed about what is going on in Ghana. So I think there will be a time and place for you to ask this question and for you to get the feedback you want. And if you see the chat, I stated that it must be directed to the Ghana AIDS Commission. So you will get a response on this soon. Thank you very much.
Thank you, Priscilla, for the clarification. Zain?
Okay, good evening. I wanted to answer Jamila's question, but I think it has been answered already. Thank you. Over.
Okay, if you want to have, I mean, an additional information, please go ahead. Okay.
May I come in, please?
Yes, of course.
Right, so I think it's high time women living with HIV stood up for themselves in the homes, in wherever we find ourselves. I facilitated an out of school program here in Ghana on the 10th of June this year, and I was sharing an experience a female peer went through with her sister who didn't have or who doesn't have HIV. She wanted to further her education, but unfortunately she's the oldest. The opportunity was given to her little sister who was negative, all because she's positive. But with time, with hard work, and with everything, she pulled resources together, and today she's done with her master's. I think it's time we stand up for ourselves. We stop being complacent, relaxed, and looking all sorrowful because we find ourselves in this very situation. I keep saying that HIV is not a death sentence. We're better off than those who have kidney issues, those who have diabetes, even better off than those with malaria. So in my view is for us to learn to stand up for ourselves and fight for our rights. Thank you.
Thank you, Chris Vic, for this. What you have said is totally true, and I think that people need to be aware that HIV is like any other chronic disease, and people are living with HIV. When they are on treatment, they can have a decent life like any other person. And I think it is because, like I said, because of lack of information, because of lack of awareness, that we have this fear of HIV, and that we cannot think of it like diabetes or malaria or tuberculosis. But we have to make sure that people get this important information, that they are aware that there is a treatment, so people are living with the treatments, and we should work now on removing the stigma and discrimination on HIV. So thank you again for this. Is there another
Please,
question?
can I chip in?
Go ahead, Benny.
Okay. Please, something small. I realize that women with disabilities faces more difficulties when they are accessing their health care, because as they are disabled, they also have HIV. So two things that dawn on them: if they try to access healthcare at the facility to try to take their treatment, because of their disabilities and the conditions that they find themselves in, it makes them feel shy. Reason being that most of the health workers mostly ignores them. Some judge them, some abuse them, insult, and then worst part is because they don't have the financial support that they can, if they achieve their daily lives goals, it makes it so difficult for them to access healthcare. And so you realize that people with disabilities and who are on ARVs are not able to go for treatment because of these things, these challenges. So I will request if people can be, healthcare system can be trained, people can be trained on the field to handle these issues, it would have been good. My little suggestion, please.
Yes, thank you, Benny, for this suggestion. And I think that women living with HIV, with disabilities, they face some unique challenges, and they require a tailored support. It starts with an inclusive healthcare service. So the country needs to ensure that the healthcare facilities and services are first accessible to women with disabilities, that it includes trained healthcare providers who are sensitive to their needs. Also they need a comprehensive support service that includes also psychosocial support, counseling, peer support groups, and also to work on their empowerment, and to advocate for their rights, for them to be able to have an active participation in the decision-making processes, whether it is at community level or individual level. And we have to to work with the on this, and to also address the stigma and discrimination they are facing, to take proactive measures against that, and to ensure that there are some legislative and policy reforms that ensure there is an inclusive healthcare support, and that there are some organizations supporting them, for this. And as I always I mean reiterate, is that I mean CLM is one of the tools that enables women with disabilities to I mean monitor the healthcare services, to inform us about I mean the quality of this healthcare, if they are inclusive or not, if there are some considerations for testing, treatment, counseling for them or not. So we have to make sure to develop this kind of mechanism to make sure that we are here to really respond and give them the required services. Zain?
Yes, please, we are leaving no one behind. Women in the prison. In our country, we all know where these women are being kept. They normally comes to the clinic. Even the food that they are eating as a normal human being is not a food for a normal human being. And when they come to the clinic, they are supposed to pay for some labs. You see the prison officers escort them to the clinic. Some too comes in wheelchairs, which stigma. Normally, even those people that are also coming for their medication, because of stigma, they will be looking at them, hey, a prisoner and also a positive, and in a wheelchair too. The way they will be looking at them is different. So I think they have prison clinics. If their medications are being taken to their clinics, they will not come to the public clinic for people to see them. And even they have to train the prison nurses, the prison healthcare workers, so that they for them to have more knowledge on this condition, so they may also take their medication at their services, not coming to the public services. So everybody will see them. The prison officer will escort them. Also, I'm a peer paralegal. And as for the education session, when we go to work in the morning, we do education. We let our people to know, especially women, to know that you can still go further your education. This is not a bridge for you to not to further your education. As far as you are taking your medication very well, you can do whatever you want to do. Sometimes after the education, people will normally call you and ask you, okay, I'm done with high school. How am I supposed to continue? They know. So people need education. It's education that they need to know. Because some people think with this, their life is stuck at wherever they are. But we do have some children that were born with it, and even now they are in higher positions in this country. So this is my concern. Over.
Thank you, Zain. I mean, for sharing this concern. And I mean, we think that no one should be left behind. We are here, I mean, working to support women in all their diversities, whether there are women, I mean, with disability, displaced women, transgender women. So, I mean, each one, I mean, of these women who are supporting are facing, I mean, different challenges, and they have we have to take key actions and consideration to address their needs. Like you said, I mean, women living with HIV who are in prison, I mean, they also require specific attention and support, and especially, I mean, when we want to prioritize planning for their, I mean, successful reintegration in the community, I mean, upon their release from prison, but also to ensure that when they are in prison, they are, I mean, having access to, I mean, quality services, and also support and treatment, and a continuity of care. So thank you again for sharing this. I mean, we would like to hear the participants who didn't talk yet, maybe to share also some ideas or reflections about what the other participants have said. maybe Sandra or Justine, Dorcas. Angela, also, if you want to have, I mean, if you have an answer about these reflections, if you want to add something, or Priscilla also.
Yeah, so I also
Go
think we
ahead,
should
Priscilla.
hear, okay. So I think we should hear from the AGYW team if there's any of them in here. I see Phoebe, Justine, Jessica. You can also share your experience. I think they were mostly engaged during the CRG process. So they are still new to the GC7. It was at the CRG process where they got to know what the Global Fund and the GC7 is. So I think they can also share their experience. Justine, Phoebe, Yaira, Jessica, please do share your experiences.
I don't know if you are talking, but you are.
Hello.
Yes.
Hello.
Hello, Jessica.
Yeah, so this is Jessica. We had the opportunity to represent the AGYW at the grants writing or the process. So we went through a couple of interventions, and then we actually had to see the kind of interventions that are tailored to AGYW, and then and then we can prioritize them and see the ones that we would later send for them to include it in the dialogue. So we did that, and then we sent. Later on, we also had a Zoom meeting, an online meeting where we met as a group, also with the technical assistance, which was Leslie, and then we went through the priorities or the interventions that we set as our priorities. And then we made sure that most of the things we chose as a group were in the dialogue or in the proposal. And then, yeah, so that was it. Thank you.
Thank you, Jessica.
So, Alia, I would just like to add that I think for this writing request, AGYW inclusion was mainly done by Hope for Future Generations. So this begs the question that if there is no CSO to push for the inclusion of adolescent girls and young women, it would have been very difficult for their active participation in the entire process. So I think this is something that we must look at. I don't know for Curious Minds, that's the AGYW group, if they have been engaged in any other instances. But reaching out to one of them, she mentioned it was only the CRG meeting where they were able to participate. Apart from that, there haven't been any participation from their side. So I think this is just a critical portion to look at. If there's no CSO to hold the hands of AGYW into these spaces, it becomes very difficult for representation to matter. Thank you very much.
Thank you, Priscilla, for adding this information. I don't know if Justine, you would like to speak? Or anyone from the AGYW team to share experience? Okay, if not, I think Angela, you wanted to speak.
Yes, I wanted just like to pose like a general question to the audience, like probably like which are like some of the advocacy tools that you already know, or that you feel that you need to like get more deep information regarding those things? Like, how can we really improve the advocacy strategies? Have you have ever before like get introduced to what an advocacy tool means, or how can you really improve on that sense? Probably that's only a general question to see if we can support also on that sense.
Maybe if you are not aware about any advocacy tools, maybe you can just help us to identify how we can improve our advocacy strategies. I mean, and how we are able to support you, like Angela said. Maybe to give us some suggestions, some recommendation that you would like to see. I mean, to be concrete.
So
I mean,
please,
just
we
like
are asking for your,
Priscilla,
yeah,
go ahead.
so please, to the team, we are asking for your contributions now. What tools do you think we can employ or we can work with to promote advocacy for AGYW? So please, this is up to us now. Kindly raise your hand or unmute to give your contribution. Thank you.
Maybe we'll choose randomly, like before. We didn't hear you, Fauzia. Can you hear us?
Hello, good evening.
Good
Yes,
evening.
please, I can hear you.
Yes.
Yes.
Did you hear us?
Did you hear? So, some of the tools that we can employ in advocacy, we can look at social media. Since these days, social media is one of the, the ways in which we can get people to interact with, and especially because we find most young people and more like majority of young ones using smartphones. So communicating via social media, for example, TikTok, Instagram, WhatsApp, sharing would help us to reach the masses. So I think that is one of the social media will be one of the tools that we can use in advocacy. Thank you, and over.
Thank you, Fauzia. And I think, like you saw in the chat, Angela just shared the video that we shared on our social media, where Priscilla is speaking about AGYW engagement in the Grand Cycle 7. So we also agree that social media is a great tool to share, key messages, key advocacy messages, and to have a lot of visibility, to mobilize, people on different, issues. So we are, we really use, our social media to support our national focal points, but also the flourish groups in the different countries. So if you have, any quote meme you would like to share with us, please just inform us, and we will be happy also to put it on our social media. Any other?
Yes. I will think through, and if there are any other suggestions, I would gladly share with the team. Thank you.
Abigail, is you spoke, or you would like to add something?
No, please.
Oh, okay.
I just wanted to ask probably to Priscilla if she can comment on the strategy that also we did together on writing the technical advocacy briefings and also like some letters. I mean, even like some of those experiences can help also the other women to see how can we really also push that forward together. And I think also like Jessica raised her hand.
Maybe.
Yeah. Can I go ahead?
Yes, of course, go ahead.
Okay, thank you. So pertaining to the tools or ways in which we can increase advocacy for the aging YW, I wanted to speak more on integration or partnership, whereby other CSOs or organizations that have the interest of aging YWs or young people at heart can come together or collaborate to do something that would help aging YW or come up with interventions or preventive interventions that will help and also scale up the process. Yeah, so maybe it can be in the form of an app or any form of education, even through a role play, an app, a short film, anything that they can come together and then do and then increase or help in that aspect. Thank you.
Thank you, Jessica, for this. I mean, great idea. And I think we, like Angela said previously, we can start with doing a mapping of organizations that might be interested in supporting and working with AGYW, I mean, programs, and who can support, I mean, different activities or projects. So it is important to map organizations and also maybe donors who can support this kind of programs. So we take note of this suggestion. Thank you, Jessica, again. So we have another suggestion from Carmi, who has to leave. So thank you again for your participation, and who is saying that for AGYW, especially for adolescents, the health system is not that friendly to freely allow them to share their issues, especially their sexual health. And she suggests that we should strengthen adolescent-friendly services and explore other avenues to reach adolescent girls. So thank you again for these suggestions as well. So maybe Priscilla, you can reply to Angela about, I mean, if you have any comment on our current strategies, what we have been doing with the, I mean, working on the letter to send to the CCM and also technical brief, our social media messages. So if you have any comments, please go ahead.
Okay, thank you very much, Alia and Angela. So for everyone's information, a month ago, we submitted a letter to the CCM calling on them to ensure that as they have included AGYW in the writing request or in the funding request, we are asking them to put in more resources and investments and ensure that these interventions are women-led. So it was sort of a gratitudinal letter and also a call for more investment and for dedicated leadership of interventions by adolescent girls and young women. And that was where we also followed up with a video by me to also continue to push the agenda, which I shared in our group chat for more interactions. So we are really utilizing the social media platforms to reach out to as many people as we can. So I think for now, we are just waiting for whatever feedback we will get from the TLP, which we will get to know whether or not there are some things we have to remove or there are some things that need working. So far, we are just waiting right now just to see what the Global Fund has to say pertaining to the funding request we submitted. And also, we are still waiting to hear the organizations that have been selected. I think it will be only one organization that will be selected to operates the entire AGYW intervention. So I think in the coming weeks, we should hear about that. So thank you very much. And I also employ everyone here to follow Women for Global Fund on their social media platforms. I think they'll share it in the chat box as well, so we can all keep in touch with the activities they are doing. They are doing a lot of activities, and it would be great or awesome if we could participate in the ones we can. Thank you.
Thank you so much, Priscilla. Thank you. Thank you all for your, very, very relevant suggestions and recommendations. I think we talked, there is another comment, I'm sorry. I think everything resolves around education, mass communication, and education via social media and other platforms, which will be helpful to people and to educate more by creating a short video or YouTube on TikTok to enhance education, especially now that the youth is into and has more interest, as my colleagues have said. We totally agree with you, Sandra, and we are working, on our social media campaign, and we hope that it will get, more visibility. And we invite you all, if you would like to share with us some key advocacy messages or quote memes, we would be more than happy to share this on our social media. Thank you again. Thank you. And I will give, to Angela a final word to this webinar before we sum up the webinar and end it. Thank you.
Thanks, Alia. And first, I want to thank also Priscilla for her engagement as our national focal point in Ghana, and all of you for participating. And my final remarks are just like, keep on advocating, keep on getting to webinars participation, find the tools, communicate, ask questions. Don't be afraid of asking or making like some comments. It's always like a space for us as women in the diversity to keep on pushing for gender advocacy and transformative actions. My final reminder is like, please take some minutes to fill up in the form that I have shared with you before, so you can also like express yourselves in that that survey. Also, as Alia mentioned, if you want to join us in the social media campaign, please contact Alia or also Priscilla, that she can also help us with her experience on recording the video. You can also like record yourselves in Instagram stories, and we will share and portray them on our social media. Or if you want to just like give us a picture of you and the key message, we can also make quote memes to portray those things in our social media and spread it. And as you said, like, of course, education is really important. So don't forget also to join us in our WhatsApp learning groups. We have like French speaking and English speaking WhatsApp groups that you can join to be in contact with us, and also take the opportunity to join us in another webinars or capacity building trainees. And all the information that we have also produced is available in our webpage. So thank you very much for everything, and let's keep on advocating for the grant making process in Ghana. Don't think that this is the end. This is just the beginning for a long-lasting process of advocacy. So thank you very much, everyone.
Thank you again, Angela, and thank you, Priscilla, for the support in organizing, this webinar in such a short time. Thank you all for your participation. I think it was really a pleasure meeting you, and also to get to know more about the work you've been doing. I think that this webinar was an opportunity to gain a comprehensive understanding of the global fund processes in Ghana, and also to explore some strategies for effective engagement of women in all their diversity, and including those that are from marginalized communities, women living with HIV, tuberculosis, women at risk of malaria, women living with disabilities in prison, etc. So I think that this webinar gave us also the opportunity to discuss and talk about the challenges, and recognize that even if some progress are made, we also still need to acknowledge the challenges that need to be addressed. And it includes, I mean, the gender-specific barriers for accessing to quality care, gender-based violence, stigma, discrimination that all women in all their diversity are facing. So I think that this is the first step to sharing the best practices, to sharing experiences and insights. And I believe that we work collectively, we can really achieve our objectives and identify solutions and advocacy strategies to promote, I mean, gender equality and I mean, empower women. So as we conclude this webinar, I would like to thank you again for your participations, and let us, like Angela said, advocate for empowering women, for promoting gender equality, and also advancing health in Ghana. So thank you again for your participation, and we will of course share with you the recommendations, the document including the recommendations, and Priscilla is here also to support you in getting important informations and to inform you about our future activities like webinars, trainings that I think will be really important for you to be part of. So thank you again, and have a nice evening all.
Thank you very much, Alia.
Thank you, Priscilla, again. Bye.
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 Okay.